Yes, so if you have read and understood, considering it communication skills session, kindly please begin. Please begin.
Can we have the name of the consultant and the name of the patients?
You just mentioned the name or names which you read in your traditional notes.
Can we name the patient X? Okay.
Yes. Okay.
Okay. And the consultant Y.
All right. Or Mr. Man
Okay.
or whatever. So please begin.
Okay.
So you can pick the call and
Okay.
introduce yourself. Yes, please.
Okay. Hello, I am Ahmed Mohammed, SHO, working for Mr. Y. I'm calling to speak to Mr.
Lad or John or whatever.
John. Okay, John. Sorry. To ask him advice about a patient who underwent right hemicolectomy for cecal tumor with liver mets. And I need to ask advice about the patient. Could I check I'm speaking to Mr. John?
Yes, this is Mr. Joe. Please summarize your case.
Okay, it's Mrs. X is a 69-year-old female patient who had been operated for right hemicolectomy for cecal cancer. The patient has urine output in the last 8 hours is about 10 to 12 millimeter ml. I checked the urine casters, which was not logged. Clinically, the patient is tachycardic with hypotensive, with hypotension, with
Abdomen is lax. Yes. It's soft. Yes.
I think he has connection
Issue.
problems.
Should I stop the timer?
Okay.
Begin, please. Yes. You were summarizing your case. Can you please continue? Summarize your case.
okay. Mr. X is a 69-year-old female patient. She had been operated 24 hours ago by right hemicolectomy for cecal cancer. Her urine output in the last 8 hours is about 10 to 12 to 20 millimeter ml. I checked the urine caster and it was not plugged. The patient is tachycardic with hypotensive and my low-grade fever. Her abdomen is soft. The pulse of the patient, the hemoglobin dropped from 12 to 10. Also, the patient have high rising creatinine with borderline urea.
Yes.
The patient urine output. The patient only received 1,100 ml of normal saline.
Okay. What do you think is the problem here?
I think patient may be dehydrated, as the patient received only 1,100 ml of normal saline for post-operative day 1. Also,
Okay,
the patient, there was a blood loss in the operation, but she received already 2 units of blood.
Okay. Do you think the patient is bleeding?
Maybe. I will monitor her vital signs and I will do a serial anatomical examination, serial abdominal examination. And if I detect any signs, I will get you updated.
Good.
Good. Okay. Do you think there is there could be any anastomotic leak in the patient?
For now, the patient is not toxic and the abdomen is soft. I will do serial abdominal examination and I arrange a patient for ultrasound abdomen. And if the patient becomes peritonitic, I will update you subsequently.
Okay. What is your plan of management now?
Okay, the patient, I will start with the patient 1 liter of Hartmann solution as fluid challenge over 1 hour, and I will continue monitoring the patient in the ward. If not response, I will refer the patient to HDU for insertion central line and start monitoring the patient. And also I will repeat all the bloods of the patient. If the hemoglobin is still dropping, I will order blood transfusion for the patient.
Good. Do you think the patient, I need to come to see the patient now?
I will start the flow challenge and I will update you subsequently and we'll show and we'll see.
How much fluids will you give to the patient?
I will give 1 liter of fluid as a fluid challenge.
Over how much time?
Over 1 hour.
Okay. Do you want to transfer the patient right now?
Sorry?
Do you want to transfer the patient?
I don't hear you, sorry.
Do you want to transfer the patient right now?
No, I will start flow challenge first.
unit.
I will start the flow challenge first and monitor the patient in the ward and see the response. If no response, I will refer the patient to the HDU.
Okay. What about do you think the patient might need surgery? Do you think there could be any anastomotic leak or peritonitis? Does the patient need...
Until now, the patient is not toxic and the abdomen is lax. And I will monitor the patient and do serial abdominal examination and I arrange ultrasound abdomen for the patient. If there are any signs of anastomotic leak, I will let you be informed.
Okay. Can you summarize your management?
Okay, again, I will start 1 liter of Hartmann solution over 1 hour. And I will monitor the patient in the ward and then see the response. If no response, I will refer the patient to the HDU for central line insertion. And also I will repeat the pulse for the patient to check if the hemoglobin is continuing to drop. I will start blood transfusion for the patient. And so I will check the cross matching for the patient.
Okay. Okay, good.
You still have 3 minutes left. And then you have to also think, if patient gets worse, what would you do? With which investigations would you proceed? And to rule out what? If patient has sudden decrease in oxygen saturation, what would you think of? How would you manage the patient?
If the patient have a decrease in, if the patient is become sudden hypoxic, I will maintain her airway.
Yes.
By oxygen mask, and I will check her breathing.
Yes.
And also circulation and the pulse. I'll put him in a pulse oximeter and check his oxygen saturation.
Yes.
And also the circulation. I will check his circulation. I will let you be informed at the anesthesia in discharge and the ITU registrar in discharge.
What would be your most likely or most possible diagnosis that you will think of? Because this is post-operative day 1 and
patient maybe called chest infection, maybe chest infection.
Yes, it does not cause sudden drop in hypoxemia or does not cause sudden drop in oxygen.
And I also have to consider pulmonary embolism for the patient.
Yes, yes, yes. What would you do then? What?
If I suspect the patient have pulmonary embolism, I will order CT pulmonary angio for the patient and also ABG for the patient to check for hyperventilation.
Yes.
And if the patient is stable, if the diagnosis was a pulmonary embolism, I will do. If the patient is stable, we will start with a heparin.
Yes.
And if the patient is unstable, we refer the patient for thrombectomy or embolectomy.
Very good. And another small thing that you can add, you'll ask for the TED stockings.
Yeah.
When you're giving the
I still start TBE for the patient.
Yes, right. If you would have to transfer the patient, in what kind of intensive care management would you send the patient and why?
Right now, if the patient have a chest problem or respiratory problem, I prefer to transfer the patient to ITU.
ITU or high dependency unit?
I think the patient
high dependency unit.
High dependency unit. Yeah.
If patients, if high dependency unit is full, what would you do?
If the I think
I-
I will
Yes.
I will search for a bed for the patient in ITU.
No, you'll talk to the bed manager. You'll speak to the bed manager and
I
you'll
will
try to arrange.
speak to the
All
manager
right. If patient undergoes, because you did say that it could be infection, if patient undergoes in a shock, what might be the causes?
Sorry?
If patient undergoes in a shock condition or a shock situation, what might be the causes?
Patient
Can you
maybe a
name
shock.
few
Do you
causes?
hypovolemic shock?
Yes, and
Patient maybe with septic shock
yes, good,
and
and
obstructive shock due to pulmonary embolism.
yes,
Also, I could have considered hemorrhagic shock for the patient.
very good. Yes, all these types. Right, good. So manage the patient accordingly. And if I need to come down or if consultant needs to come down, let the consultant know. Good. Thank you, both of you.
Thank you.